Now lawmakers are debating massive changes to Medicaid. It could shrink the program for millions. Missouri Senator Josh Hawley says he opposes the cuts, but could his plan still result in cuts for people on Medicaid now? Our political editor, Mark Maxwell, is digging into the details. Mark.
Yeah, when a politician promises no cuts, it's always important to read the fine print. Tonight, we're taking a closer look at proposed rules that would require people in poverty to satisfy paperwork and work requirements to qualify for their health insurance benefits, and whether that would constitute a cut either in spending at the government level or in just cutting them off from access to their doctor. Far from the marble halls of Congress, freshman House Democrat Wesley Bell toured the Affinia Healthcare Clinic in North St. Louis to show what the national debate over Medicaid really means.
We're talking about poor folks, folks who need these services, many of which are working folks with jobs.
Senator Josh Hawley has come out against key parts of the House Republicans' so-called one big beautiful bill.
It's very different than what the House negotiated with the president. It's different from what the president negotiated. I can't figure out why in the world we would so radically depart from the president's own framework.
In the opinion pages of the New York Times, Hawley says he opposes slashing health insurance for the working poor, calling it both morally wrong and politically suicidal. But the plan he does support would impose new rules requiring people in poverty to prove their employment status or lose their health insurance.
The states that have tried to impose these work requirements have learned a bitter lesson. If they miss filing one of those deadline requirements, they cut off. They lose their health insurance, not only for them, but for their kids.
We've offered Senator Hawley an interview to explain his position or how these new rules would work. Congressman Bell described it as Washington wordplay or doublespeak that deals a direct blow to family caretakers or mothers who look out for their kids at home.
What we're seeing is a workaround to justify what actually would be cuts and what actually would kick millions of Americans off of Medicaid.
Senator Hawley has also said changes like these might protect the financial solvency of the Medicaid program for those who really need it. But the budget scorekeepers at the nonpartisan Congressional Budget Office project millions would still lose coverage.